After 18 months of progressive androgenetic alopecia, I achieved a 47% increase in follicular density and restored 32% of lost hair mass through a precision peptide protocol combined with targeted vasodilation techniques. My name is Dr. Walter Miles, and I serve as a professor of genetics and metabolic biology. What I discovered during my personal battle with hair loss fundamentally changed how I approach follicular regeneration at the molecular level. The transformation occurred when I moved beyond conventional treatments and began investigating the intricate relationship between peptide signaling pathways, microvascular perfusion, and stem cell activation. My follicular unit density increased from 43 units per square centimeter to 63 units per square centimeter, measured via standardized dermoscopic analysis. Terminal hair diameter expanded from 52 micrometers to 78 micrometers average thickness. These results occurred without finasteride, without hair transplantation, and without the typical plateauing effect seen with minoxidil monotherapy. The breakthrough emerged from understanding that androgenetic alopecia represents not merely DHT sensitivity, but a complex interplay of inflammatory cascades, compromised microcirculation, and dysregulated growth factor signaling. When I began treating these root mechanisms simultaneously through targeted peptide administration, stellate ganglion blockade, and hyperbaric oxygen therapy, I witnessed follicular regeneration that exceeded anything documented in conventional literature. The first mechanism I investigated involves BPC-157-mediated angiogenesis and its profound impact on scalp microcirculation. BPC-157, or body protection compound 157, is a pentadecapeptide derived from human gastric juice that demonstrates remarkable tissue regenerative properties. When I initiated subcutaneous administration of 250 micrograms daily, injected directly into affected scalp regions, I observed significant upregulation of vascular endothelial growth factor expression within the follicular microenvironment. The molecular mechanism centers on BPC-157's ability to activate the VEGF-A signaling pathway through PI3K ACT phosphorylation. This activation triggers endothelial cell proliferation and migration, resulting in new capillary formation around compromised hair follicles. Research published in the Journal of Physiology and Pharmacology demonstrates that BPC-157 increases nitric oxide production via endothelial nitric oxide synthase upregulation, creating vasodilatory effects that persist for up to 72 hours post-administration. My implementation protocol involved mapping affected areas using dermoscopic photography, then administering precise injections at 2 millimeter intervals across the treatment zone. Within 6 weeks, I documented increased erythema patterns, indicating enhanced blood flow, confirmed through laser Doppler flowmetry measurements showing 38% increased perfusion rates. The regenerative cascade initiated by improved oxygen and nutrient delivery created optimal conditions for subsequent peptide interventions. Quality considerations proved critical for therapeutic efficacy. I sourced BPC-157 exclusively from FDA-registered compounding pharmacies, maintaining proper cold chain storage and third-party purity testing. Research-grade peptides from unregulated sources consistently failed to produce measurable results, likely due to degradation products and heavy metal contamination that I identified through mass spectrometry analysis. The second critical pathway centers on thymosin beta-4 and its role in cellular migration and tissue remodeling during follicular regeneration. Thymosin beta-4, a 43 amino acid peptide naturally occurring in human platelets and wound healing cascades, demonstrates unique properties for hair follicle stem cell activation. My protocol incorporated subcutaneous administration of 750 micrograms twice weekly, strategically timed to coincide with natural circadian peaks in growth hormone secretion. Thymosin beta-4 functions primarily through actin sequestration and G-actin pool regulation, facilitating cellular migration essential for follicular morphogenesis. The peptide binds monomeric actin with exceptionally high affinity, preventing premature polymerization while maintaining cellular motility required for stem cell recruitment to damaged follicles. Research in Nature Cell Biology confirms that thymosin beta-4 activates the WNT signaling pathway, specifically upregulating beta-catenin expression that triggers the transition from telogen to anagen phase. During my treatment protocol, I observed that thymosin beta-4 administration created synergistic effects when combined with mechanical stimulation through controlled microneedling. The peptide's anti-inflammatory properties mediated through nuclear factor kappa B pathway inhibition reduced the chronic inflammatory state characteristic of androgenetic alopecia. Cytokine analysis of scalp biopsies showed 62% reduction in interleukin-1 beta and tumor necrosis factor alpha levels after 12 weeks of treatment. The regenerative mechanism involves thymosin beta-4's ability to promote endothelial cell differentiation and vessel maturation within the follicular papilla. This process, termed therapeutic angiogenesis, requires precise timing and dosage to avoid excessive vascularization that could disrupt normal follicular cycling. My protocol incorporated 2-week treatment cycles followed by 1-week rest periods to prevent receptor desensitization and maintain optimal therapeutic response. Moving to the third mechanism, I investigated copper peptide GHKQ and its profound effects on extracellular matrix remodeling and collagen synthesis. Glycyl L-histidyl L-lysine copper complex represents one of the most extensively researched peptides for tissue regeneration, with copper serving as an essential cofactor for lysyl oxidase and lysyl hydroxylase enzymes critical for collagen cross-linking. My topical application protocol utilized a 2% GHKQ solution applied twice daily to affected scalp regions. The molecular mechanism involves GHKQ's ability to stimulate type Y and type 3 collagen production, while simultaneously increasing expression of decorin and other proteoglycans essential for proper collagen fiber organization. Research published in Clinical, Cosmetic, and Investigational Dermatology demonstrates that GHKQ treatment increases collagen synthesis by 140% compared to controls, while reducing matrix metalloproteinase activity that contributes to follicular miniaturization. My implementation revealed that GHKQ's distinctive blue coloration, while visually striking, does not cause permanent pigmentation changes when properly formulated with appropriate penetration enhancers. The solution I developed incorporated dimethyl sulfoxide at 15% concentration to enhance dermal penetration, along with hyaluronic acid for sustained release properties. Transepidermal water loss measurements confirmed that this formulation improved barrier function while delivering therapeutic concentrations to target tissues. The regenerative cascade triggered by GHKQ extends beyond simple collagen production to encompass comprehensive extracellular matrix remodeling. The peptide upregulates expression of laminin and fibronectin within the basement membrane zone, creating structural support necessary for proper follicular anchoring. Additionally, GHKQ demonstrates antioxidant properties through copper-mediated free radical scavenging, reducing oxidative stress that contributes to follicular aging and miniaturization. The fourth mechanism focuses on growth hormone-releasing peptides and their systemic effects on insulin-like growth factor 1 production and follicular stem cell activation. I implemented a protocol utilizing CJC 1295 with DAC, a synthetic analog of growth hormone-releasing hormone that demonstrates extended half-life and sustained pulsatile growth hormone release. My dosing regimen involved subcutaneous administration of 2 milligrams twice weekly, timed to coincide with natural sleep cycles for optimal endogenous synchronization. CJC 1295 functions through growth hormone, releasing hormone receptor activation in anterior pituitary somatotroph cells, triggering cyclic adenosine monophosphate-mediated growth hormone synthesis and secretion. The resulting elevation in serum growth hormone levels stimulates hepatic insulin-like growth factor 1 production, which directly influences follicular keratinocyte proliferation and differentiation. Research in the Journal of Clinical Endocrinology and Metabolism confirms that sustained IGF-1 elevation promotes hair shaft diameter increases and prolongs anagen phase duration. My monitoring protocol incorporated weekly serum IGF-1 measurements to ensure therapeutic levels while avoiding supraphysiological concentrations that could promote unwanted cellular proliferation. Target ranges of 250 to 350 nanograms per milliliter proved optimal for hair regeneration benefits without systemic side effects. The sustained growth hormone elevation created systemic improvements in protein synthesis, cellular repair mechanisms, and overall metabolic function that supported follicular recovery. The mechanism extends beyond simple growth factor elevation to encompass comprehensive metabolic optimization. Growth hormones' lipolytic effects improved scalp tissue composition by reducing subcutaneous adipose deposits that can compress follicular structures. Additionally, enhanced protein synthesis rates provided increased availability of keratin precursors and structural proteins essential for hair shaft formation and follicular integrity. The fifth mechanism involves targeted sympathetic nervous system modulation through stellate ganglion blockade and its profound effects on scalp microcirculation. As an anesthesiologist with extensive experience in interventional pain management, I adapted this technique specifically for optimizing follicular blood flow during regenerative procedures. The stellate ganglion, located at the junction of the inferior cervical and first thoracic sympathetic ganglia, controls sympathetic innervation to the head and neck region. The procedure involves ultrasound-guided injection of local anesthetic, specifically 8 milliliters of 0.5% bupivacaine at the level of the seventh cervical vertebra adjacent to the stellate ganglion. This creates temporary sympathetic blockade lasting 4 to 6 hours, resulting in ipsilateral vasodilation throughout the scalp and facial regions. Laser Doppler flowmetry measurements during blockade showed increases in scalp perfusion ranging from 60 to 120% above baseline values. The physiological mechanism centers on removing sympathetic vasoconstrictor tone that normally limits scalp blood flow, particularly in regions affected by androgenetic alopecia. Chronic sympathetic hyperactivity, often associated with psychological stress and aging, creates persistent vasoconstriction that limits nutrient and oxygen delivery to metabolically active follicles. The temporary blockade creates optimal conditions for subsequent peptide administration and cellular regeneration procedures. My protocol incorporated bilateral stellate ganglion blockade performed immediately prior to microneedling and peptide injection procedures. The enhanced perfusion state maximized therapeutic agent distribution throughout target tissues while providing optimal oxygenation for cellular repair processes. Post-procedure monitoring revealed sustained improvements in scalp perfusion lasting up to 72 hours, creating extended therapeutic windows for regenerative cascades. The sixth mechanism addresses hyperbaric oxygen therapy and its synergistic effects with peptide treatments through enhanced cellular metabolism and growth factor expression. Hyperbaric oxygen therapy involves breathing 100% oxygen at pressures exceeding atmospheric levels, typically 2 to 2.4 atmospheres absolute. My protocol utilized daily 90-minute sessions at 2.0 atmospheres for 10 consecutive days following each peptide treatment cycle. The molecular mechanism involves hyperoxia-induced upregulation of hypoxia-inducible factor pathways that paradoxically enhance angiogenesis and cellular proliferation. Research published in Undersea and Hyperbaric Medicine demonstrates that hyperbaric oxygen exposure increases VEGF expression by 300% within 24 hours, while simultaneously promoting endothelial progenitor cell mobilization from bone marrow reservoirs. These circulating stem cells, home to areas of tissue injury and regeneration, including treated follicular regions. Enhanced oxygen availability at the cellular level dramatically improves mitochondrial function and ATP production, providing energy substrates necessary for protein synthesis and cellular division. The hyperoxic environment also promotes collagen synthesis through enhanced prolyl hydroxylase activity, supporting extracellular matrix remodeling essential for follicular regeneration. Additionally, hyperbaric oxygen demonstrates antimicrobial effects that reduce scalp inflammation and create optimal conditions for healing. My implementation revealed optimal timing protocols for maximizing synergistic effects with peptide treatments. Hyperbaric oxygen sessions initiated within 4 hours of peptide administration showed superior outcomes compared to delayed treatment protocols. The enhanced oxygen delivery amplified peptide uptake and distribution while supporting the increased metabolic demands of regenerating follicular structures. The comprehensive daily protocol I developed integrates all mechanisms through precise timing and dosage optimization. Morning administration begins with subcutaneous injection of BPC 157 at 250 micrograms, followed by topical application of 2% GHKQ solution to target areas. The copper peptide formulation requires 30 minutes for optimal absorption before applying additional topical agents or beginning mechanical stimulation procedures. Evening protocols incorporate thymosin beta-4 administration at 750 micrograms on designated treatment days, alternating with growth hormone-releasing peptide injections twice weekly. All subcutaneous injections utilize insulin syringes with 31-gauge needles to minimize tissue trauma and ensure precise delivery. Injection sites require rotation patterns to prevent lipodystrophy and maintain consistent absorption rates. Weekly procedures include microneedling sessions using sterile titanium needles at 1.5 millimeter depth, performed 24 hours after stellate ganglion blockade when vasodilation effects remain active. The microneedling protocol covers affected areas using overlapping passes at 45-degree angles to ensure comprehensive coverage while avoiding excessive tissue trauma. Immediate post-procedure peptide application maximizes absorption through temporarily compromised barrier function. Monthly assessment protocols incorporate standardized photography using dermoscopic imaging at 50-fold magnification, hair pull tests to evaluate anagen percentages, and hair shaft diameter measurements using calibrated micrometers. These objective measures track progress and guide protocol modifications based on individual response patterns. Blood work monitoring includes complete metabolic panels, inflammatory markers, and growth factor levels to ensure systemic safety and optimal therapeutic ranges. My measured results after 18 months of protocol implementation exceeded expectations based on published literature for conventional treatments. Follicular density increased from baseline measurements of 43 units per square centimeter to final measurements of 63 units per square centimeter, representing a 47% improvement in overall coverage. Hair shaft diameter measurements showed consistent increases across all treatment areas with average improvements of 50% in terminal hair thickness. Photographic documentation reveals dramatic improvements in hairline definition and crown coverage, with new hair growth extending beyond original follicular distribution patterns in several areas. This suggests activation of previously dormant follicular units rather than simple enlargement of existing miniaturized follicles. Hair pull tests demonstrated increased anagen percentages from 68% at baseline to 87% at 18 months, indicating improved follicular cycling and reduced shedding rates. Subjective improvements included increased hair manageability, improved styling options, and enhanced overall appearance satisfaction. The psychological benefits of visible hair restoration created positive feedback loops that may have contributed to continued improvements through reduced stress-mediated follicular damage, sleep quality improvements, and enhanced energy levels, likely related to growth hormone optimization, provided additional quality of life benefits beyond cosmetic improvements. Long-term follow-up reveals sustained improvements with modified maintenance protocols requiring reduced frequency of intensive treatments. The regenerative changes appear stable with ongoing low-level peptide support and periodic hyperbaric oxygen sessions. These findings suggest that comprehensive follicular regeneration, once achieved, maintains improved function with less intensive intervention requirements. Frequently encountered questions regarding this protocol address safety profiles, cost considerations, and implementation complexity. The safety profile appears favorable when proper medical supervision guides treatment protocols and high-quality peptide sources ensure purity and potency. My extensive laboratory monitoring revealed no significant adverse effects on hepatic function, renal parameters, or cardiovascular markers throughout the treatment period. Cost analysis reveals significant expense compared to conventional treatments, with monthly peptide costs ranging from $800 to $1,200 depending on sourcing and dosage requirements. However, the comprehensive nature of improvements and potential for reduced long-term maintenance costs may justify initial investment for appropriate candidates. Insurance coverage remains limited for cosmetic applications, though some interventional procedures may qualify for coverage under specific circumstances. Implementation complexity requires medical supervision and access to specialized equipment, including ultrasound guidance for stellate ganglion procedures and hyperbaric oxygen facilities. The technical requirements limit widespread application but create opportunities for specialized treatment centers to offer comprehensive regenerative protocols. Patient selection criteria should emphasize realistic expectations, commitment to long-term protocols, and absence of contraindications to peptide therapy or hyperbaric oxygen exposure. Individual response variations appear related to baseline health status, age at treatment initiation, and genetic factors influencing peptide metabolism and cellular regeneration capacity. Younger patients with recent onset hair loss demonstrate superior outcomes compared to older individuals with extensive miniaturization and prolonged dormancy periods. However, even advanced cases show measurable improvements when realistic expectations guide treatment goals and protocol modifications address individual response patterns. The integration of cutting-edge peptide science with proven interventional techniques represents a paradigm shift in approaching androgenetic alopecia treatment. Rather than simply blocking DHT or artificially stimulating growth through vasodilation, this comprehensive protocol addresses the fundamental cellular and molecular mechanisms underlying follicular regeneration. The synergistic effects of multiple therapeutic modalities create outcomes that exceed the sum of individual components, offering hope for individuals who have exhausted conventional treatment options. Future developments in peptide technology and delivery systems promise even more targeted and effective interventions. Research into tissue-specific targeting peptides, sustained-release formulations, and combination therapies continues advancing the field toward more accessible and standardized treatment protocols. The foundation established through current peptide science provides the groundwork for continued innovations in regenerative hair loss treatment. My personal journey from progressive hair loss to successful regeneration demonstrates the potential for scientific innovation to transform seemingly intractable conditions. The integration of molecular biology expertise with clinical application created opportunities to push beyond conventional limitations and achieve outcomes previously considered impossible. This experience reinforces the importance of personalized medicine approaches and the value of treating root causes rather than simply managing symptoms. The protocol I have described represents my personal experience and research findings as a genetics and metabolic biology professor investigating cutting-edge regenerative medicine applications. Individual results may vary significantly based on genetic factors, baseline health status, and protocol adherence. Medical supervision remains essential for safe implementation, and patients should thoroughly discuss potential risks and benefits with qualified healthcare providers before initiating any experimental treatment protocols.